Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Scher, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Before today's episode, I have a message from the podcast producers, Master Clinicians. Master Clinicians is a CME company that I use to help me stay up to date and meet my CME requirements. They have a ton of courses in their library from urgent care, primary care, women's health, pediatrics, emergency medicine, and they also offer travel CME. And quite a bit of it is actually free. So if you're looking for ways to get your CME credits, I highly recommend checking out Master Clinicians. There's no cost to sign up, and the link will be in the show notes. With that, I'm going to turn to my colleague and guest, who I'm really excited to introduce, Dr. Sarah Wittrey. And
Hello.
Sarah, if you can tell, she's on break at work, so we're going to do this as best we can.
Yes.
Yeah, so Dr. Wittry is a hospice and palliative care physician and also a wellness coach for physician moms. And since the last episode, I had someone who focused on men, I thought it only appropriate to balance that out with Sarah and bringing you on today. So thanks so much for joining me.
Absolutely. Thank you so much for having me, Jennifer. I'm excited to be here, even though it is, in the midst of a work day. I definitely wanted to carve out time, and it's really important to have these conversations. So I'm
Yeah, I
excited to
mean,
be
isn't
here.
that the way we just do things,
Yes,
especially busy moms? You're probably a busy working
totally.
mom, right? You just got to squeeze it in when you can.
Totally.
So let me have you start, as I start with most people, with you maybe sharing your journey to medicine and specifically palliative care.
Sure, absolutely, absolutely. So I think I don't have a particularly exciting journey, I wouldn't say, to get to medicine. I think it was something even from an early, like probably middle school or even definitely by high school, I was like pretty sure I wanted to do healthcare and then just kind of gravitated toward knowing most I possibly could and like really curious. So it felt like medicine and kind of going the physician route was the right way for me. Um, and then, to get to my specialty, it was a little bit more, I don't know, I took a lot of twists and turns along the road. But I initially thought I wanted to do pediatrics for a very long time.
Huh.
And was really interested in actually like pediatric hematology and oncology. And I did a lot of work with that population in college and did some research in that area. Ended up being like emotionally too challenging for me to be able to like separate, the
Yeah.
kids and the ones that aren't doing very well from like personal life.
Yeah.
Um, so I ended up actually choosing residency in physical medicine rehab, and loved that like wide spectrum that brought, and being able to still work with children as a possibility as initially like one of the
Sure.
reasons I chose it. And then as I kind of got into my second year of residency, I was at an academic institution and really overlapped a lot with the palliative care team there, in joint family meetings, in talking about, really, really complex patient cases, with a lot of families and patients. And so I basically fell in love with their specialty because of kind of the intimate relationship that they got to have and kind of conversations, really, really transparent and open, that I wasn't getting a lot in my other
Right.
rotations or even in residency. And so I think it was like, having that team approach was really prevalent in both PM&R and palliative, and really kind of, yeah, leaning on one another's perspectives and expertise. It was very much drawn to, and then just the kind of the level of humanity I think that palliative care brought was felt like it sealed the deal for me to pursue that fellowship.
Sure. I wonder if palliative care, you were initially interested in hemonc for
Yeah.
peds.
Yeah.
both deal with, unfortunately. I wonder if it's because your patients are have lived a full life that it's a little bit easier for you than it was with like,
Right. Yeah, no, I think that you're right. I think in some ways, for sure, I had a lot of people that were really close to me and knew me best when I was really interested in like PT monk, and they were like, I think that maybe you just really like children and you want to be a mom and also be a doctor, but not have that be it's going to be too hard for you to like not carry it home.
yeah, got it.
Yeah.
So you chose palliative. At what point did you become a mom in your journey?
Yeah. So I have a difficult journey probably as well, like non-traditional pathway to motherhood.
All right,
But I
so
had,
traditional for medicine, non-traditional for motherhood. Okay.
yes, yes. Um, but we were planning to have our first child in the third year, like beginning of third year of residency was the plan.
Okay.
Um, and we did become parents at the end of that year, but it was through foster care actually that we brought our first baby home.
Really?
Yeah, we became foster parents because we I went through infertility during residency. So that was like, the plan that kind of the initial plan got thwarted.
Mm-hmm.
Um, and yeah, that was something that was not on our radar, right?
Wait, so you were still in residency and took on the role of foster?
Yes. Yes.
You really did want to be a pediatrician.
I know, totally. Yeah. No,
My
it was
goodness.
I know, it was a wild time. Those few years were probably some of I mean, definitely most challenging, right? Like looking back, you're like, what were we doing? How did we do it?
Yeah.
But also, I mean, they were just like super, yeah, rewarding and amazing years too.
Yeah.
Like they changed me a lot as a person.
So are you still a foster mom, a foster parents?
So, not active foster parents anymore. We ended up adopting our first son that we had. So, that was kind of unique in foster parenting. We were able to
Oh,
adopt him. He was only, 4 weeks when he came to us. We adopted him when he was one. And then um, we have we have four kids altogether now. And two of them, the oldest two, so the first one, Asher, who's now 8 years
hmm
old,
hmm
and then our oldest child, Anna, who is 12, was from foster care as well. But she didn't come to us until she was about 6. So those are, you have two children from foster care adoption and two biologic.
So you ended up being
We
able to
ended
have
up
your
with,
own.
yes, yep, yep. It was one was a surprise. That was in fellowship when I was pregnant with him. And then the very last one, our little girl, she is 2.5 now, and we went through infertility again later. And so she came to us through IVF. So, like I said, kind of a random assortment of how we built our family. But
Yeah. I mean, you're sharing the story very joyfully, but I
mhm.
imagine that it wasn't so joyful along the way.
No, absolutely. I mean, I think it's one of those things I learned, and have processed over time and therapy and a lot of things is just that uh, it's a lot like a lot of things in life that, you plan things and you're really sure and almost like really attached to your plans. And then for lots of reasons, right, they just don't work out as planned. And it's like learning how to pivot and adjust, but also holding a whole lot of space for the grief that comes with
Yeah.
infertility. It's an area I'm really passionate about now just because, I didn't sense a lot of support or I didn't feel like I had a lot of almost, yeah, time and resources, in residency to be able to process in the way that I think, women deserve to be supported through that journey because it's unexpected. It's like, um,
Yeah.
very much feels, like it's something you're supposed to be able to do as a woman and be able to have kids and all that. So it just feels like there's a lot that's not fair about it.
Yeah.
And yeah, I think mental and emotional support for women going through infertility is just so, so critical.
I'll tell you, and it's also uh private, or not that
Yes.
not that it should be or needs to be, but it's almost like you don't talk about it. I remember for myself, I had a miscarriage at one point,
Hmm.
And I mean, you start talking to people and you hear, oh my God, everybody's, right? Everybody.
Yeah.
But
Yeah.
somebody said to me, and I just wanted to be sort of sad and process it and whatever.
Mhm.
Well, at least now you know you can have kids. Or like, at least it's not
Mm.
a, right? Like, it's not so bad.
Yes.
People give you,
Yes.
and okay,
Totally.
yeah, but like, I want it to be that bad right now,
Yes.
just for a
Yes.
minute, and then I'll move on.
For sure. For sure. Like we can't rush those things, but we kind of
Right.
want to, or some people want to because it's uncomfortable to talk about, you know? I think you're so
Yeah.
right. You're so
Right.
right. Yeah.
Um, all right. So you have a huge busy family and a busy work life. How did
Hmm.
you find coaching and how do you integrate it all? And, tell me where you went from
Yeah.
here.
Yeah. I found coaching like early on in the pandemic. And I describe myself as like a personal development kind of junkie. Like I love reading about it. I love listening to podcasts about it. Like I've always been like that. Definitely like felt like I needed to up level some things in my life when I became like a parent and a foster parent and all those things, all those new roles, right? Um, but then I felt like during COVID, I really went through just it, yeah, it was over capacity, right? It was like the things I had been doing were no longer working. I was trying to do too much, and I felt like pretty deep in burnout. Like no matter where I was failing. It just felt like I couldn't come up for air, is what it felt
Well,
like. You know what I
Sarah,
mean?
during COVID, I imagine for a palliative care specialist, you must have been
Hmm.
really at
Yes.
the,
Yes, yes. Yeah, there was so much distress. So we were so busy. The emotional layers of it, with the everything going on with our patients that were dying of COVID in the ICU all the time, every day. The
oh,
family, trying to support them and trying to support the staff. It was like all of these other specialties and people that just no one had tools, no one knew what to do. And it's not like, we didn't necessarily know better. We just were like more comfortable talking about some of it,
mhm.
and some of the grief and loss and everything. And so, yeah, we were definitely feeling it as a team, and then feeling it on the home front just because of, all the stuff happening in the world and at school and trying to, you know, have something left to give family when you got home. And it just, that's when I discovered coaching. It's like as
Yeah.
additional tool to therapy and those kind of things, because I really needed some kind of hope, I think, of like how to manage this because I knew it was not a sustainable thing for me. And
Yeah, and
that's,
I want to
yeah.
thank you for all you did during that time. I shared with some, but we had another guest once who also was in palliative care, and I shared that my dad received palliative care from a
Mm,
doctor just like you during that time, and it
hmm.
was such a meaningful, really, really, I can't thank you enough, really.
Yeah.
I'm a little bit
Well,
speechless about that. But it's funny that
yeah.
you took that as an opportunity to learn a new skill.
Well, well, I think I like recognize, I don't know, I recognize my limitations, right? Like I could sense that the way it was going was going to lead to either like me leaving medicine or me just being like a really miserable mom and spouse. And that's not who I knew myself to be, not what I wanted it to be. And we talk to our patients all the time in palliative care about like, what do you want your life to look like? What's most important to you? How do you
Yeah.
come back to those core values, right? And so it's like when I wasn't living that, and I very much was aware that I wasn't living that, it was like, I need something. I need something.
Yeah.
Um, yeah.
And wouldn't it be nice to have those conversations instead of right at the end when it's
Yes.
early so that you can
Yes.
actually live many years along those lines before?
Yes. Yes, definitely. And I think that's what I discovered, right, with the tools of coaching and group coaching and one-on-one coaching and stuff, really getting deep in that helped me to clarify that on another level for myself, right? And really like empowered me to craft and create, how I wanted my life to be and knowing that it's going to keep changing with different seasons and all of that.
Yeah.
Um, and yeah, as I went through that process, I was like exactly what you said, like this is so important. I want other people in medicine, women in medicine to be able to do this as well so that they're not spending years of their life or,
Yeah.
their whole career being like, I don't like it, but I'm just doing it because I don't see another way, you
Yeah.
know?
So Sarah, at my company, we just ran the AMA does these organizational biopsies to look at
Hmm.
well-being in your clinicians or in
Yeah.
whoever you want. So one of the takeaway messages from our organization, w when they broke down the burnout, they actually found that our younger female clinicians had
Hmm.
the highest level of burnout of any of the doctors in the company. And I
Yeah.
wonder if, with the
Yeah.
work you do, maybe you can shed some light on why that might be and things that I could potentially do to support them.
Sure. Yeah. I mean, I think unfortunately that doesn't surprise me, and I think that there's just culturally a lot working against young female physicians who are becoming mothers or are early, have young children. Um, because, yeah, we're conditioned in medicine to sacrifice ourselves for our patients, right? Be
Hmm.
selfless and work and work and work, to always be available, to always be improving ourselves, outside of when we're actually at work. Um, and then we add the parenting on, and it's a whole new role, right? It's like you can't separate it. It definitely is integrated into work and life. And so I think we try to also, as high achieving women, try to really take on the role of being, the best possible mom and being as present as we can. And so I think universally experience some form of pretty significant mom guilt, right?
Hmm.
That we don't believe we are the best mom or the best doctor, and that we feel like we're failing no matter where we are, kind of,
Right.
is the general kind of sentiment that I think we have. And, add that on to kind of unrealistic expectations about what we should be able to do, what our capacity is, as well as, just general not having, for the most part, very adequate support from institutions, hospitals, kind of comparison that we have to our male colleagues.
Hmm.
And it just really, it creates like the perfect storm, so to speak, of, us feeling inadequate and burned out and just like kind of dissatisfied and stuck.
Yeah.
Um, yeah, yeah.
Yeah. I feel like I lived through that. I'm on the other side of it now. I definitely feel like I lived through
Hmm.
a lot of that. I look at role models who's done this well and who's navigated it well, and I just want to share a quick story. My sister, who is not a doctor, but she was also
Hmm.
like she's was a high-powered attorney and she was also a mom. And I'll never forget the story. She was on this call and somebody was trying
Hmm.
to set up the next meeting and she just matter-of-factly said, I can't do that. That's my daughter's preschool graduation. And when I
Yeah,
heard that, I was hard. Like I would have made up some excuse that wasn't like
sure.
kid related.
Yes,
And at the time, I thought she was crazy. And over the years, I reflect back, I'm like, God, she is so, she had it
yes,
right.
right, right. I know. And I think that's so much of what that work is, right? To be able to like separate what's expected of you and what you should do and should say, and kind of stepping into that place of like really, really getting clarity on like what is non-negotiable to you, what you're not going to, budge on no matter what, like,
Yeah.
and having your own back in that and being like, yeah, I'm probably going to ruffle some feathers. I'm probably going to, not please everyone around me all the time. But like at the end of the day, like if you're true to yourself and you're like, these are my priorities, and not feel like you need to be apologizing for them. I really
Yeah.
think that's where we can live and work in a place where like we feel like we're in control, we're in the driver's seat. You know what I mean? Because
Yeah.
we are going to upset people because it's against the status quo.
How long does it take for someone who is feeling the way you just described to
Hmm.
typically feel a little bit better and a little bit more in control and empowered?
Yeah. I mean, gosh, that's a wide variation. I think I do this work all the time and I'm still working on it, right? There's still, because they're deep-seated narratives that we have in our heads about them. But I think people can feel a difference within a month or two. Like they can feel some pretty significant shifts because it's a lot about like kind of unraveling all of it and then being like, what do I actually want and desire? Because for most women, that's like very much suppressed, right? Like we've
Hmm.
covered it up, we've just kept going, head down, um, kept being a workhorse like we are, and kept putting other people's needs ahead of ours. And so that part is, I feel like probably a lifelong thing, but I feel like we can make really significant progress in even just a few short months.
Do you find that most people end up being able to stay where they currently are with new guardrails? Or do most people just decide, ugh, I don't want to be a doctor anymore and I'm just going to be a mom? Or what?
No, no. I think people do stay, and what I think is really cool is that there might be small adjustments that people make, right? Like saying, I'm not going to work weekends anymore. I'm going to cut down to like point 0.8 or something FTE. Some little things that they really feel like this will make a significant difference to me in my life, and it helps me in all ways. Um, but I think it's cool that like, and what I tell people I work with is like, you can do this work with a coach or with your community, and then really be able to show up the same on the outside. Like all your situations are the same, but you're totally different in how you feel
Yeah.
internally on the inside. And I think that's the coolest part.
Yeah.
Um,
I say
yeah, so it doesn't have to change.
you can change everything and change nothing.
Yes, yes,
It's
totally,
it's really
totally.
amazing. So, when we first met, you were telling me a little bit about in the training that you had that you did some somatic work and training with polyvagal
Hmm.
theory and work with that. I was wondering if you could explain that a bit.
Yeah, yeah, absolutely. So I think like the easiest way to understand some of the polyvagal theory and just kind of how our nervous system plays a really integral role in our mind-body connection um, is to think about, well, we all know about like fight, flight, freeze, right? The sympathetic activation. And I think that because of so many factors, that is where the majority of what I would classify like physician moms, working professional women, right? They like almost always default to that state. Like we are just on the go, always putting out fires, right? Like that our mind and body is like activated, right?
Hmm.
We're producing, we're achieving, we're checking things off, like we are primed and ready. um, and then we have kind of um, two other states. So we have, the parasympathetic state that is more like being able to be calm and regulated and present and connected, right? That we can feel like we can slow down and engage in social relationships and everything. That's referred to as like ventral vagal state. Um, and then the third state is dorsal vagal, and that's kind of the freeze or shutdown state, right? And that's what I describe as when people are go, go, go all the time. You may notice times, right, where you kind of are just like, I'm checked out, I'm tapped, I can't do anything else, like almost like this disconnection. And people can liken it to, feeling depressed or feeling shut down and
Hmm.
just like they just don't care. That's when you're just like, you have a lot to do or that you should do or whatever, but you kind of just like veg out, scroll on your phone, like disconnected,
Yeah.
and that is what our nervous systems respond to when we cannot keep going. Like when we push the limit too long for days or weeks or whatever, and we're just
Yeah.
like, can't do it anymore. So our way to like protect ourselves, right? And what I find is that, yeah,
Wait,
when
so
we,
what before you go on, do you
yeah,
mean that you have the sympathetic and the parasympathetic on opposite
hmm
ends, right? And the
hmm
sympathetic being super activated, you got your fight, fright. For me, I always thought your fight, flight, freeze, and fawn that were
hmm
all different expressions of that same state. Are you saying
hmm
that it's actually a third root?
yeah, that's what polyvagal is all about. Is that it's like called, the dorsal vagal. So it's more evolutionarily old.
Uh-huh.
And that is it's like essentially more of the freeze state where like we can't really engage in very much, right?
Yeah.
We don't want to do anything. And I think evolutionarily, it's like because we realize we can't outfight whatever we're trying to do.
Mm-hmm.
So it's like our way of chronic stress leading to, nope, right? I can't do it anymore. I'm burnt out.
Yeah.
I am not able to keep going.
So interesting. So it's like your overwhelm can lead you to either sympathetic overload or dorsal vagal.
Yeah. Yep.
Huh. Okay.
Exactly. And
Interesting.
so, yeah, there's a lot of work that's pretty cool as far as, being able to identify, like understand how the nervous system works, which I think we like as doctors, like, right?
Yeah.
But it's different to understand how your nervous system works
Yeah.
and kind of how you're in different states, right?
Mm-hmm.
Because we can kind of notice and be aware of it in real time,
Yeah.
kind of notice how much time we're spending in our day in certain states.
Yeah.
And, our ideal state, like we're going to fluctuate a lot throughout the 30 different ones.
Yeah.
Um, but the more that we can notice when we are in the less desirable states, right? And return to that ventral vagal state where we're like, you have thoughts that are like, I can do this. I'm okay. I'm resourced, right? I'm going to be able to meet the challenges and
Mm-hmm. So
also,
I
it's
just
okay to
actually
rest.
the last few days, I actually just virtually attended, but the Herbert Benson Mind Body Medicine Conference. Have you ever been
Mm,
to that?
no.
Oh, it's wonderful, but a lot talks a lot about this, and I found it interesting when they were talking, about being in, that sort of your peak performance is in that state, that position
Yes.
of your nervous system that you're describing, and
Yeah.
talking about how different stressors obviously
Hmm.
can move you, but different people have different windows of what,
Yes.
right? Based on what
Yep.
you then do with you call resourcing. They can, it can be the lifestyle choices, how much sleep you've had, how much
Yeah.
exercise, all of those things, plus the mindfulness and all of those things. And then if you're
Hmm.
someone who has trauma in your history, then your zone is going to be smaller. And
Yes.
I just,
Yeah.
really like that perspective because it's much more holistic and not just, okay, this is happening, and so I'm going to end up in my dorsal vagal root.
Totally.
It empowers you a
Totally.
little bit.
Yes, you're totally right. Yeah. Yeah, I think the same language concept is like the everyone has their own unique window of tolerance, right? Of
Yes.
how much stress and stuff they can tolerate before they flip into one of those states where,
Right.
you find yourself being kind of edgy, reactive, irritable. Um,
Yeah.
yeah, I call it like black trash bag energy when you just like are overwhelmed with your house and you start like decluttering everything and throwing it all away.
Yeah. And then you really go overboard sometimes.
Yep. It's like,
Regrets. Regrets.
yes,
So do you
yes.
have one or two favorite tips that you teach the moms you work with that help them expand their window of tolerance?
I think over time, so it's definitely a stepwise thing, right? Where we have to really understand ourselves more first so that we can know what we're in more. But once we have a good awareness of our like unique states, then I think that it's really helpful to experiment with different like regulation tools because there's so many, right? It can
Hmm.
be as simple as like literally putting your feet on the ground,
Yeah.
taking those three like grounding breaths and like being noticing what's around you, right?
Yeah.
Like visually orienting, which sounds so simple, but really truly when we are going so rapid and there's so many inputs coming at us, right? To
Right.
just look around and be like, huh, I see, like name as many green things as you can see. And that really just focuses our brain on being back to what's in the here and now, what's
Right.
happening right now, and it
Hmm.
calms down like our sympathetic drive. Um, and so I like to do, yeah, like visual orienting,
Hmm.
grounding, like diaphragmatic breaths, the kind of sensory things, like 5 things you can see, 4 things you can smell, 3 things you can taste, through 2 things you can hear, one thing,
Yeah.
like those type of things. Um, and then I think, yeah, like people are so variable, but like figuring out like 1 or 2 things that work for you, that they
Yeah.
have like a good payoff for you, so to speak, right?
Yeah.
And you're like, oh, I'm noticing that I'm getting really activated right now. Ooh, now I know what to do. I'm not just
Yeah.
like at the whim of, oh, well, I guess I'm screwed, I'm just gonna go
Right.
off the rails here.
Yeah.
But like doing those practices and kind of layering those tools can
Hmm.
be so helpful and honestly empowering, because you feel much more in control of like your mental state, your emotional state, when you give yourself compassion for it, right? Being
Yeah.
like, oh, I'm noticing that it makes sense that I'm this way. I've just had, 5 really challenging patients today, or I've just had my kid, I got called that my kid is sick, and now I have to figure out how to like rearrange all
Hmm.
of this. But so often we don't think we have time to do those things, but then it kind of, without that, right, it can kind of spiral in ways that we don't like and
Yeah.
that we regret. Yeah,
Yeah.
yeah.
One of the things that I always like to tell people and that I practice myself
Hmm.
is the concept of doing it as a routine, right? Not waiting until you're in one of those
Hmm.
states, right? The regular
Yes,
routine practice and how to build that into something you're already doing, creating new
totally.
habits by attaching them. So for me, every time I put my hand on the door, when I go from one room to the next, I
Hmm.
pause for like, I mean, whatever it takes, just to take
Yeah.
a deep breath. I know other
Yep.
people will do it when they're washing their hands or whatever it is, but just to make that something grounding as part of your
Yes.
routine, so that will help you over time
That
build that
window.
space. Yeah, build that
Yes.
window.
Absolutely. Absolutely.
Yeah.
Those proactive things are so important when we're doing them. So you're right. So we're not waiting until it's like a crisis, but we're really expanding our window of tolerance by doing those like proactive lifestyle things and, just little tweaks here and there, and choose one. Don't try to be like, I'm going to overhaul my sleep, my nutrition, my
Right.
exercise all at once, right? Like we're going to
It's
stop doing
like
that like
that New Year's
tomorrow.
resolution that's certain to fail. Yes.
Yes. Yes.
Oh boy. All right, Sarah, I know I've kept you for quite some time and you have to get back to your patients. Let me see if you have any last minute things to share and then tell me how people can reach you if they want to, and then I'm going to let you go.
Oh, thank you so much. It's been lovely talking. I mean, I'd say I just like to leave people with encouragement, right? Of like, no matter where you are and no matter what stage of life you're in, what you're going through, kind of even how bad it seems. Um, and it is your reality, and it can really be difficult and dark and hard and like feel very much stuck in like there's no way out. I would just say like hold on to a tiny bit of hope, right? That things can change over time and that they can feel better to you, and also that you deserve that. And even if you can't believe it for yourself, right? That it seems like, nope, not my situation. Like just maybe looking to others who um, have gone through the same things as you and who are going through the same things as you and are like basically trying things a little bit different ways, and try like being open and curious to possibilities, because I think that that is where magic can happen, when it's like those tiny little windows of like maybe right,
Yeah. Yeah.
possible, for this to feel better or easier. So yeah, hold on to that hope, even if it's like difficult to see for yourself, because you deserve to live a life that's in line with what matters to you, and not to wait for it. Like if you're sensing a lot of suffering now, or you're experiencing a lot of really challenging times and your days are really hard, like know that there is hope and there are people to help guide you, and like people that they're cheering for you, right? And they'll want that
Yeah.
for you.
So Sarah wants to see you today and not when you need her for palliative care.
Yes, that is true. That is very true.
All right. So
Yes.
if if a stressed out mom wants to find you, I'll put your links in the show notes,
Yeah,
but do
sure,
you have a
sure.
website or something?
Yeah, it's Vibrant Humans. Then my whole name, sarahwittrey.com, is my
Perfect.
website, and you can find everything there. You could also search that same name, Vibrant Humans, on podcast. I have a podcast that I talk about like personal development, working mom stuff, that is available on Spotify and Apple Podcasts.
Perfect. All right,
Yeah,
Sarah, thank you again for joining me. It was a true pleasure.
of course. Thank you.
That's all for this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at sharecoaching.com. Thanks for listening, and don't be afraid to live your best life.